So, why don't family doctors talk to you about stress as a heart risk? Neither your cardiologist nor your family doctor is likely to discuss stress as a heart attack risk factor, and here's why. Each has a very specific medical role on your health team. The family doctor's is to coordinate all medical treatments that you're receiving. Let's look at how family doctors approach the question of stress and your heart risk. Family doctors are compassionate and busy. Family practices are very busy places. In a typical day, the family doctor will have to deal with dozens of medical conditions, complications of those conditions, and also complex cases. The amount of clinical reading that the doctor has to do in order to provide best practice to their patients is staggering. Time is scarce. Most family doctors rely on two things. One, they're specialists, and two, on current clinical guideline summaries to get the key interventions right. Very few family doctors will have heard of InterHeart. One resource family doctors do use regularly is a best practice summary service like eMedicine or UpToDate. These give doctors expert summaries of the best practice guidelines for common medical problems like the heart patient. So what do they say about treating the heart patient? You'll find a chart like this one. It highlights the traditional medical risk factors like cholesterol, blood pressure, and diabetes. What you won't find on this chart is stress. No reference to it anywhere. Why? Well, if you have so many legitimate medical issues that you have to manage, time to investigate something that's as subjective and as complex as stress is limited. If you were sitting with a heart patient in front of you and you reviewed this chart, what would you do? I'll tell you what most responsible doctors do. They'll use the chart like a checklist to make sure that they've covered off all of their patients' medical risks for further cardiac problems. That's why a doctor will rarely go beyond the list to investigate other issues like stress. But this is where our website can help you and your doctor. Does the busy doctor miss anything when they bypass stress? Busy doctors will not know that a full third of their patients' risk for having a heart attack has not been evaluated or treated when they miss stress. Significant heart risk will be missed in about 1 patient in 3, and you may be the one. What can you do about this? We can help you. HeartStressRisk.com is the only place that helps you actually evaluate whether you are at risk from stress or not. And it will provide you with a profile of the risks of greatest importance to you. There are 3 steps that you can take immediately to get informed and stay informed. 1. Complete our 2-minute screener at the bottom to see whether stress is an issue for you. 2. Complete our heart stress risk profile to understand all of your risks. And 3. Sign up for our newsletter. If you know of any other sites that do a better job of educating you about the relationship of stress and heart attack, please send us the link. Take the Heart Stress Risk Profile test